Have you ever wondered how systemic failures can impact a healthcare giant like the NHS? The National Health Service, commonly known as the NHS, serves as a shining example of public healthcare, not only within the United Kingdom but across the globe. Yet even this healthcare behemoth isn't impervious to the effects of systemic failures. But what, you might ask, are systemic failures? They're not mere hiccups or isolated mishaps. Rather, they're indicative of deeper issues that can ripple across the healthcare landscape, causing a domino effect of disruption. When we talk about the impact of these failures, we're not just talking about one aspect of healthcare. We're talking about a multidimensional impact that spans across clinical, financial, ethical, and social spheres. Picture this. You've been waiting months for a crucial surgery, and then it gets postponed because of a lack of resources. That's a systemic failure. These delays aren't just digits on a spreadsheet, they're real-world instances of suffering. They can lead to medical errors, delayed treatments, and compromised patient safety. The quality of care dips, affecting patient outcomes and, in extreme cases, costing lives. But the damage doesn't stop at clinical repercussions. These systemic failures can plunge the NHS into a financial quagmire. Emergency interventions to rectify failures often come with a hefty price tag. And when public trust dwindles, patients might turn to private healthcare, further draining the already limited resources of the NHS. Add to this the litigation costs from medical errors, and you're looking at a vicious cycle of systemic inefficiency. Healthcare isn't just a service, it's a right. So when systemic failures in the NHS disproportionately affect the most vulnerable sections of society, it becomes a question of justice. These failures also ripple out into the community, affecting public perception and trust in an institution that is considered a national treasure. Systemic failures in the NHS are not just organizational issues, they are societal concerns that warrant collective action. We must all be a part of the solution. It's a tall order, but one we can't afford to ignore. Imagine waiting months for a critical surgery only to have it postponed due to a lack of resources. This isn't a hypothetical scenario for many patients within the National Health Service. Systemic failures, like resource shortages, have tangible real-world implications that deeply impact patients' lives. These systemic failures can lead to medical errors. Picture a busy hospital ward where the staff is stretched thin. In such an environment, it's all too easy for mistakes to be made. A missed medication, a misread chart, or a delayed diagnosis. These aren't just inconsequential blunders. They can have serious health consequences for patients. These systemic issues also result in delayed treatments. Imagine being told that you need to wait months for a treatment that could alleviate your pain, improve your quality of life, or even save your life. It's a harsh reality for many who are stuck on ever-growing waiting lists due to systemic inefficiencies. And then there's the matter of patient safety. In an ideal world, a hospital should be a haven, a place where patients feel secure in the knowledge that they are receiving the best possible care. However, systemic failures can compromise this sense of safety. Inadequate staffing, faulty equipment, or poor infection control practices can put patients at risk. Each of these factors, either individually or collectively, can impact patient outcomes. If treatments are delayed or medical errors occur, patients' conditions can worsen. In extreme cases, what might have initially been a manageable health issue can become a life-threatening situation. So, what we see is that systemic failures in the NHS aren't just abstract concepts or administrative headaches. They have a human face. They represent the struggle of a patient in pain, waiting for treatment. They reflect the anxiety of a loved one, hoping that a medical error doesn't occur. They embody the fear of a patient concerned for their safety in a hospital. The quality of care takes a hit, affecting patient outcomes and, in extreme cases, costing lives. This is the clinical toll of systemic failures, a toll that's measured not just in numbers, but in human suffering and lost lives. Systemic failures are not just clinically damaging, they are financially draining. This point bears repeating as we delve into the financial implications of systemic failures within the National Health Service. When we think of healthcare, our minds often first go to the clinical side of things, the doctors, nurses, and patients at the heart of it all. But healthcare is also a business, and like any business, it relies on a steady flow of resources to keep its operations running smoothly. When systemic failures occur, they often necessitate emergency interventions to rectify the situation. These interventions are not just disruptive, they also come with hefty price tags. Resources that could have been allocated towards improving patient care or investing in much-needed infrastructure upgrades are instead diverted towards putting out fires. This is financial mismanagement in its most detrimental form, and it's a burden that the NHS and ultimately the taxpayers bear. But the financial implications of systemic failures extend beyond these immediate costs. Let's consider the loss of public trust. When the public loses faith in the system, they tend to seek alternatives. For many, this means turning to private healthcare. As more and more patients move towards private care, the NHS sees a decrease in funding, further straining its already limited resources. And then there's the matter of litigation costs. Medical errors, often a result of systemic failures, can lead to lawsuits. These legal battles not only tarnish the reputation of the NHS, but they also come with substantial financial implications. The money spent on legal fees and settlements is money that is not being put towards improving patient care. Add all these factors together and what do you get? A financial quagmire that feeds into a vicious cycle of systemic inefficiency. It's a cycle that perpetuates itself, with each failure leading to more financial strain, which in turn leads to more failures. Add to this the litigation costs from medical errors, and you have a financial quagmire that feeds into a vicious cycle of systemic inefficiency. Healthcare is not just a service, it's a right. This powerful statement underscores the ethical implications of systemic failures in the NHS. These failures are not just administrative hiccups, they are breaches of trust that have real-world consequences. They disproportionately affect the most vulnerable sections of society, leading to health inequalities. Imagine being a patient from a marginalized community, struggling to navigate the labyrinth of healthcare bureaucracy. Now add systemic failures into the mix. Suddenly, the challenge is not just about getting the right treatment, it's about getting any treatment at all. The result is a growing chasm of health disparities, where your socioeconomic status determines your access to quality healthcare. But the ethical dilemma extends beyond access. Systemic failures can also lead to breaches in patient confidentiality due to data management failures. Picture this. You entrust your most sensitive health information to your healthcare provider, only to find out that it has been mishandled or worse, exposed. This is not just a violation of your privacy, it's a violation of your trust. And it's not just patients who are bearing the brunt of these failures. Healthcare professionals find themselves in the throes of moral distress. They are trained to heal, to care, to empathize. But when systemic failures cripple their ability to provide the level of care they aspire to, it's more than just frustration. It's a profound sense of helplessness, a gnawing guilt that they could have done more if only the system had allowed them to. And then there's the elephant in the room, the question of accountability. When systemic failures occur, who's to blame? Is it the frontline healthcare professional who's juggling a myriad of tasks in a high-pressure environment? Or is it the decision-makers who may be far removed from the realities of patient care? This ethical quagmire is a stark reminder that healthcare is more than just a clinical enterprise. It's a moral endeavor. And as we grapple with these systemic failures, we need to remember that at the heart of healthcare is human dignity. We need to ensure that this dignity is preserved even in the face of systemic failures. Healthcare professionals often experience moral distress when systemic issues prevent them from providing the level of care they are trained and committed to deliver. The impacts of systemic failures in the NHS are not confined to hospital corridors. They send ripples across society, altering public perception and trust in an institution that is often seen as a national treasure. When systems fail, the public's faith dwindles and these failures become political footballs, shaping public policy and governance. The effects of these systemic failures don't stop at policy. They permeate the very fabric of our communities. It's not just about the healthcare provided within hospital walls. It's about the health of our society as a whole. The systemic failures in the NHS can compromise community health, influencing social determinants like employment and education. When healthcare fails, it impacts the overall well-being of individuals and communities. The broader community health is compromised, affecting social determinants like employment, education, and overall well-being. Building systemic resilience involves not just patchwork solutions, but a rethinking of the entire healthcare ecosystem. It's about understanding that these aren't isolated incidents, but rather interwoven threads in a complex tapestry of healthcare delivery. It's about acknowledging the multidimensional impacts of these failures, from clinical and financial to ethical and societal. We must work collaboratively to dissect these systemic failures, identify the root causes, and devise robust strategies to prevent their recurrence. It's about fortifying the NHS from within, cultivating a culture of continuous learning and improvement, and fostering a resilient system that can withstand the inevitable challenges that lie ahead. It's about recognizing that healthcare is a right, not a privilege, and making a commitment to safeguard this right for every individual. It's about restoring trust in this national treasure and ensuring its sustainability for generations to come. It's a tall order, but one that we cannot afford to ignore. Support the necessary reforms in the NHS today.